Your toddler's still going to be eating beige food and buttered noodles when they're 3.5. No matter if their favorite food was avocado and salmon when they were 8 months old, it's a normal developmental track for pickiness to increase. That's what we expect, and it's not really a problem, but I think it can decrease pickiness.
Hello, and welcome back to another episode of the Birth Lounge podcast. If you are feeling overwhelmed and unsure of where to turn to for evidence-based education around your pregnancy and birth, maybe you've just found out that you're pregnant and you don't really even know where to start. Maybe you're well into your pregnancy and you're starting to have questions, but you're having a hard time understanding what is honest, data-driven, science-backed education versus what is just viral and circulating on the internet. Then I want to introduce you to the Birth Lounge app. This is an app that is designed to put the control back in your hands no matter where you are in pregnancy. It's available for iPhone and Android, so head to your respective app stores and type in the Birth Lounge app, and you'll be able to download the app directly to your phone and access it anytime. So one of my favorite features is the week-by-week update of fetal development. And you know me, I'm not going to be comparing your baby to the size of a lime or an apple or a cantaloupe or something. No, I want you to actually know what's going on. When I say data-driven, I mean it. I want you to know, hey, this week you're growing kidneys. And hey, guess what? This week you're working on them ears, baby. I want you to know exactly what your baby is doing inside of your belly so that you can stay informed, so that you know no matter where you are in pregnancy, you are the decision maker. You have free will and autonomy, and you have access to data that will help you make the best decisions for you and your family. In addition to that week-by-week update of what your baby's actually going through, you're also going to find pregnancy and postpartum evidence-based articles. Now, these are going to tackle your most common questions. Should I really get tested for GBS? Why do we test for gestational diabetes? What is the science behind hiring a doula? Do I really need to write a birth plan? What is the best position to birth my baby in order to reduce my push times and decrease tearing? What are the newborn procedures that I should expect after my baby is born? How much should my baby be eating? How do I establish good breastfeeding? What about newborn sleep? Help, the umbilical cord fell off. OMG, I'm still bleeding and I don't know if this blood clot is too big. All of it is inside of the Birth Lounge. Not only do you get those evidence-based articles, but I link all of the data for you so that you can click on it. It's clickable links. I want you to be able to access the data that I'm talking about. You can just rely on me to synthesize it, but I'm still going to give you the resources that I'm sharing with you. And in addition to that, at the end of every single article, there are questions broken down that you can take back to your provider to ask them so that you can truly have this collaborative, respectful communication with them to make sure that not only are you getting evidence-based medical care, but that you're really building this really respectful, collaborative relationship and getting individualized care from your healthcare team. Head to your app store, whether you have an iPhone or an Android, and download the Birth Lounge app. I promise you it's going to be such a game changer.
Hey friends, Alexis here from the Birth Lounge team. I remember being a first time mom, sitting at my kitchen table surrounded by tiny jars of baby food, spears of bananas, spears of avocado, baby led weaning books, Googling which to start first, reading Facebook posts, posting questions in groups about baby led weaning and feeding purees, and then panicking over every what if. What if my baby chokes? What if they hate the food? What if I'm doing it all wrong? The stress was real, and honestly, it can feel overwhelming trying to navigate starting solids. That is why I'm so excited about today's episode with Alex King from Baby Led Weaning Academy. Alex is a postpartum doula and baby led weaning expert who makes mealtimes calm, realistic, and even, dare I say, joyful. Yes, even with the mess all around you. She helps parents take the fear and the endless Googling out of feeding, showing you how to follow your baby's cues, introduce foods safely, and honor your child's natural instincts. If you've been following HeHe's Doula Talk series, you may have seen Alex there sharing her insights of pure gold. And in this episode, we get the full deep dive on readiness signs, gagging versus choking, safe allergen introduction, and how baby led weaning and purees can work together to make starting solids feel simple and empowering. Grab a pen, settle in, and get ready to finally feel confident and calm about feeding your little one today.
Alex, welcome to the show.
Hi, so glad to be here. Thanks, HeHe.
I'm so happy to have you. I love having my friends on the show. Like, obviously, I love having all the guests that I have, and my listeners know that it's invite only on the show. So, I do handpick the guests, and a lot of our conversations are driven by my audience. They ask for these topics, and then I go out and I find the experts that I want to have on this show and that I feel are evidence-based, but there is a just an additional layer of love when it gets to be one of my friends. And so I'm so excited for this conversation, not only because of the topic that we're talking about, but because it's you, and I'm so excited to have you here. So thanks for joining me. And I'm really excited for the topic because, we always think about pregnancy and birth, but we don't so much ever think about postpartum and the extensions of postpartum that come beyond wearing the big pads and leaky boobs. But just a few months after you have your baby, we are going to be introducing solids. It's going to be time to start to think about introducing solids. And depending on your pediatrician, it may happen earlier rather than later. And so I want people to have evidence-based information, and B, I want them to be prepared for that conversation when their pediatrician brings it up, because I think a lot of times parents can feel really caught off guard, and then they are stuck spiraling like, oh my gosh, well, what do I do? Is it the right time? Is my baby ready? Do I do baby led weaning? Do I do puree? Should I delay it? And so you are the it gal when it comes to baby led weaning, and so I'm so excited for this. And I think that I'd like to start on a really like basic level. Could you break down, when it comes to introducing solids, what actually is baby led weaning? Because I think a lot of people think about like make mushy food, make purees, feed them off of a spoon, but that's actually not our only option.
Yeah, baby led weaning at its basic is throwing all of that you just mentioned kind of out the window. We don't need the mushy purees and the spoon feeding. I always like to break it down for people that baby led weaning, the biggest part of it is that it's led by the baby. It's right
Mm.
there in the name. And it gives them the autonomy to feed themselves. So to me, that's the biggest part. If we're talking mechanics, it is skipping purees and we go straight to soft finger foods like slices of avocado or roasted sweet potato. Babies can eat meat right from the beginning. So we're skipping the pureed carrots and rice cereal, and they're eating real food from the beginning, and they're also self-feeding. I'm a little bit different than some other baby led weaning people you might hear on the internet and all the noise because I'm not big on the rules, the strictness of it. So I'm not anti-puree, but I do encourage mamas to still follow baby-led philosophies if they do purees. So you'll never catch me airplaning a baby with the spoon into the mouth. But we eat purees as adults. I eat applesauce and mashed potatoes and yogurt, and those are all technically puree. So it can be part of baby's diet, but baby led weaning is kind of a whole philosophy.
Okay, now when you said babies can eat meat from the beginning, I felt in my soul my audience clutching their pearls like, what? Are you crazy? So tell us a little bit about this introduction. Like when you say babies can eat meat and they can eat soft finger foods, what do you actually mean? Because we're clearly not giving our 7-month-old a ribeye and saying like, have at it, little Henry. Like, what are we actually doing?
I mean, you can. Clutch your
Oh
pearls. I'm going to blow your mind.
my
One of
God.
my postpartum clients, so I'm a postpartum doula by nature. And so I have, clients that I work with for the first 6 to 8 weeks. And a lot of them come back around when they're baby led weaning. And I just the other day got a picture of a little girl that I met at 3 days old, and she had a little hunk of steak in her little 6-month-old hand. So meat is actually super important in baby led weaning because why we start solids when we do is they don't need the nutrition of it. They're getting the calories and the fat and all that from milk still. That's the most important part. But iron deficiency starts to kind of kick in. They need more iron. So meat is actually like a super high value one. They aren't like obviously chewing the meat and swallowing it, but even just like an index finger sized strip of ribeye, and they're gumming at it and sucking on it and getting the iron out of the juices is actually like a really good early first food.
Okay, and what other early first foods are you talking about? Like spheres of banana, avocado, uncooked celery and carrots? Are we letting our babies chew on that?
Avocado, yes, that's like the quintessential baby led weaning first food. I think it's gross, so
Okay,
it's not my go-to.
because you don't like avocados?
Because I don't like avocado. It's my
Okay.
unpopular opinion. I started with banana when I was feeding my first baby. We started with spears of banana. And so that's kind of my like nostalgic go-to first food. But also there's not really a perfect first food, It can be anything that's cut safely and the right texture, which is soft and squishable. And with littles around that 6 to 9 months mark where they're still using their whole hand to grasp, it's called the palmar grasp before they can use their index and thumb. The pincer grasp, we use spears. Bigger pieces are safer than smaller pieces. The celery and carrot is, I don't recommend it. Can be a choking hazard. People use it for more like teething and resistive foods. It just makes me nervous.
Yeah. Okay, to hear you say like bigger pieces are safer than smaller pieces, I think that probably shocks a lot of people because a lot of people's inclination is to go with really small pieces so that your babies don't choke. So explain that one to us.
Yes, it's one of the biggest, like mind-blowing, wait, what? What did she just say? So, what happens if you chop up a bunch of tiny little pieces of carrot and your baby can't use their finger and thumb to pick up one piece? What they do is they pick up a whole handful of them. They scoop them up, and now they have a whole handful of, say, 15 little tiny pieces of carrot in their hand, and that all is going to go right into their mouth. And then it's very easy for one of those to kind of slip back into their mouth. And since there's so much going on, it's more likely to slip past the gag reflex and end up sliding further and increasing the risk of choking. Whereas on the alternative, if you give a baby a an adult finger sized piece of carrot that they can grasp in their hand, they might bite off. Like we are encouraging them to eat. It's okay if people are like, what if they bite off a small piece? I'm like, well, that's the goal. We do want them to bite. That's how they're going to learn to chew. But they're much more likely to end up with one small piece in their mouth that they bit off the top of the spear. And they're more in control of how that's moving around in their mouth and developing the oral motor developmental skills. And if it does get too far back, it will trigger their gag reflex and they'll spit it back out.
That is so interesting. Okay, so when does a baby lose that gag reflex where they'll actually be able to swallow pieces of food?
There's really no set timeline on it. It comes from practice and it comes from just kind of taking too big of bites and putting too much food in there and it being triggered, and it will slowly over time move further back in their mouth so that they can swallow from the beginning. It's not that everything, the first bit is going to come right back out. It's just if it's too big. I always tell mamas, I know it's scary, but you want your baby to gag. You should be happy when your baby is gagging because that means that they're protecting their airway. They're doing exactly what they're supposed to do.
I think that gagging is probably one of the most common, I guess, things that I hear parents say that they're fearful of, right? It is one of the most common things that keeps parent from doing baby led weaning. They say, I don't want my baby to choke. I don't want them to gag. Or when they do gag, parents feel really activated and triggered by that. So if your baby is gagging, now we've established it's a good thing and that we should be appreciative. What else do we need to know about gagging? Do we help them? Do we just make sure that they are still breathing and they're making noise, kind of like CPR rules? Are we getting them out of their chair? So if your baby is gagging, what do we do as parents?
My best advice to sum it up is sit on your hands, but
Love
I
it.
will give you some more because I get it. Like, it's really scary, especially when it's your baby and the first few times it's happening. I hear all the time, oh, my baby was choking. And I was like, I always have to dig a little deeper and like, tell me what happened because 99.9% of the time they mean my baby was gagging. And it is scary. A little like rhyme to help kind of remember the difference is loud and red, let them go ahead. That's gagging. Silent and blue, they need you. That's
Oh,
choking.
that's so
So,
helpful.
yeah, gagging is loud, it's dramatic. Their face might turn red, they're retching, they might even throw up. It's unfortunate, but it's kind of just part of the process. And they don't need you to intervene. You actually can, it can get more dangerous if you do try and do that little finger swipe in the mouth to try and get the food out. If they're gagging, they're working on it, and you can just wait and watch. I like to kind of talk them through it, which is for their benefit and my own, and say something like, good job, you're gagging. You're doing what you're supposed to. You're pushing that food forward in your mouth. Great job. And just kind of stay calm and collected. If you jump scare your baby, that's gonna, get them off their track. So keeping yourself as regulated as possible to kind of let them do the work that they're doing. And then if it does turn into the silent and blue, they need you. That's where, knowing the CPR and how to handle choking is important, but it's such a rare occurrence. But gagging is a super common occurrence. So knowing the difference is really important.
Yeah, wow, that little rhyme is life-changing. I've never heard anything like that, and I'm going to take that with me. I assume that we're very aligned in this. Do you also believe that all parents should be trained in CPR, especially when it comes to introducing solids and just like having children in your home?
Absolutely. I mean, there's no reason not to do it
Yeah.
and to just be prepared. And because even when you know the skills, when an emergency happens, it's so hard. So do all you can to be ready and prepared as much as you can.
Yeah, for sure. That adrenaline's going to kick on, and you're already going to have such a hard time accessing that part of your brain. So I think, you guys have heard me say it a million times, take a CPR class, know the basics. I agree with you. There's no reason not to. Okay, in terms of looking for signs, so we just kind of defined gagging versus choking. I think a lot of people, and I mentioned it, when we first started talking, they get a little caught off guard when their pediatricians recommend introducing solids on the earlier side. So, most people are familiar with introducing solids between 4 and 6 months. But if you've had a baby recently and your baby's just now 4 months and you feel like you're just now emerging from that newborn phase and your pediatrician's let's introduce solids, you're like, what? So, what kind of signs are we looking for? They're called readiness signs, but what kind of things are our babies exhibiting to let us know that, yes, they may be ready for solids? And are they different whether we're going to start with purees versus baby led weaning like spears and soft finger foods?
Okay, there's a lot to break down there. So, for the easiest one to talk about is age-wise. A lot of doctors, you're going to still walk in into that 4 month checkup and they're going to say it's time for rice cereal and mashed and pureed peas. And a lot of babies aren't ready for that developmentally. And there's a lot of research coming out still about their gut health and that they're not ready for anything besides breast milk or formula at that point. For baby led weaning, the true like skipping purees, the finger foods, avocado, broccoli, those things, we need to be waiting at least until 6 months.
Okay.
That calendar date is at least there, but then age is not really a developmental readiness sign. So that's a minimum. And then you're looking for them being able to sit up unsupported. They don't need to be sitting for 20 minutes straight. Babies are still a little wobbly around 6 to 8 months. Like, that's okay, but we don't want them slumped in their high chair or needing to be held up or reclined because a safe swallow comes from their body being supported. And we want them to be able to hold their head up for basically that same reason. Another readiness sign that isn't necessarily a must have, but it makes everything a lot easier is when the tongue thrust reflex has faded. That one's a tongue twister and hard for me to say. But a lot of times, a 4 month old, if you put something in their mouth to protect themselves because they shouldn't be having that, their tongue will just push it right back out. And that usually fades around 6 months, but it's not always all the way gone. And so it can just be frustrating if everything that touches their tongue, the instant they just push it right back out. So it's not so much a safety or a readiness, but just sort of a frustration thing. And the same with interest in food. That's always on the readiness checklist. That's not a safety issue. It just makes it a little bit easier if your baby is showing some interest in food. They're watching you eat, they're grabbing for things and that they have the hand-eye coordination to put things into their mouth. Usually not a problem. Babies are usually putting more than we want them to put in their mouth.
Yeah. Okay, I want to circle back to that, but before we do, I'd love to dive into rice cereals and other non-nutritious additives. So I think a lot of pediatricians kind of default to saying like, yeah, put some rice cereal in some breast milk or some formula and then give it to your baby. And it's like, yeah, but that doesn't add any nutritional value to your baby, right? It's just basically a filler in their belly. So talk to us about what we need to know about rice cereals and maybe what we can do instead.
Absolutely. It kills me. I see this in Facebook groups every day almost, especially when we went to the pediatrician and they're not happy with my baby's weight. And so they want me to start solids. And the math just ain't mathin'.
Mhm.
Like breast milk or formula is this high fat, high calorie, nutrition packed thing, and you're gonna give them basically rabbit food. Like pureed carrots are not gonna help with weight gain. I don't understand it. I don't know.
Yeah.
I don't get it. Every time I think that just doesn't, I don't even know how to argue with that because it just doesn't make any sense. And basically the same with rice cereal. Yeah, our grandmas were putting rice cereal in our bottles when our parents were babies, but it's so unsafe. There are like very specific medical instances where they use formula or breast milk thickeners, but that should be like done in a medical way with supervised, but nobody should be just randomly adding rice cereal to bottles at night to help keep their baby full longer. Yeah. If I could get no one to do that ever again, I'd be happy.
Okay, so what can we do instead? Should we be maybe like mixing mushed up avocado? I know it's not your preference, or mushed up banana, or is this a place for us to maybe give purees before bedtime? If we are concerned about weight, obviously maybe getting with an IBCLC or a feeding specialist would
Mhm.
probably be a better place to start rather than just like trying to add something to their food. But if we are trying to get them to sleep longer periods of at night and we think that giving them a fuller belly is the answer, what are the options that we have?
If people want to start purees before that 6 month mark, I actually just have this a freebie. I'll drop the link at the end, but I made a freebie called Puree the Baby Led Weaning Way. And that's kind of talking about how to use the philosophy, which is to let babies self feed. And so you can do those purees and cereal. There's a whole thing about the heavy metals in the rice cereals, so I always recommend starting with oats rather than rice. But also, there's people all around the world that eat rice as a main part of their diet. So I'm not too here or there. I don't have a super strong opinion on that. But I think that if we are worried about the full bellies and all those things, most people actually should start solids in the mornings because it can disrupt babies' sleep and if they have a little like tummy adjustment. So it's really not a great method to increase sleep, is the basic answer.
And what are some other signs that we might look out for when we're introducing solids? I don't think I realized that it could give them some gastrointestinal upset.
Yeah, it's definitely a thing that it affects like poop will change. It's like a big topic in baby led weaning mom groups is when you switch from just straight milk to adding in other things, like diapers are gonna get weird.
Huh.
And if you ever feed your baby beets, be aware. It will be scary.
It'll look
Um,
bloody, it'll be red.
yeah, most likely.
Wow, okay. And are you looking for like a difference in consistency and texture, but also color? Like, are all of those pretty normal when you introduce solids?
Yep, it all changes.
Okay.
Smell. Moms talk a lot about poop. It becomes a normal part of your life to talk about poop when you're a new mom.
And someone
And
else is at that.
yes, exactly. Someone else's poop. Who knew that you would spend so much time talking about someone else's poop? But yeah, consistency can change. Also, frequency, constipation is more likely, especially when you're starting fruits. And so people will use like prune puree with constipation, introducing small amounts of water. They don't need a lot when they're starting out. It's more about skill building, but constipation can get kind of normal while their little intestinal tract is trying to figure out this new stuff you're putting in there.
And are there foods that are better than others to start with in terms of texture or nutrition or I guess really considering anything. Maybe I think a lot of things that I hear are, I don't want to start with fruits because I don't want to start with the high sugar foods. Is that really a thing or is that more of a myth?
It's a myth. You could probably speak to this better than I could, but breast milk formula, it's sweet. Amniotic fluid is sweet.
Yeah.
So saying, oh no, I gotta feed my baby broccoli before banana because they'll get used to sweet things is kind of silly to me because they've been having sweet things for 16 months already.
Yeah.
So I don't worry about it. Something that I teach my clients is like kind of 5 buckets to have variety because I think that's more important than what specifically you choose first. But you want to be introducing fruits, you want to be introducing vegetables, different starches like potato, cornmeal, flour, and then protein and iron sources. And then also allergen exposure is a really important like part of baby led weaning and it's scary. It's a part of introducing solids. You have to do it eventually. That's one thing that sometimes parents are like, oh, I could never do baby led weaning. Okay, but eventually your baby is going to have to move on from being spoon fed, even if that's where you feel comfortable starting. I'm not here to vilify the traditional weaning. It's just that baby led weaning is another way. I think it's really great. And eventually they have to get to eating solid foods that are not pureed.
Yeah. Okay, let's get real. Dressing your postpartum body is a whole situation. You want to feel put together, but also like not wear jeans. You want to be comfortable, but not the ratty tatty sweatpants from college that have holes in them and the drawstring is so frayed that you could literally French braid it. Hey, I know. And you need something that can handle the spit up, the leaking, the marathon cuddle sessions. I get it. That's where Cozy Earth's bamboo jogger sets come in. These have honestly been my new mom uniform, and I do not say that lightly. These joggers are ultra soft, like wrap me in a cloud and don't talk to me type of soft. They have got a relaxed fit that is just enough shape to like feel intentional, and it's made out of bamboo. So the fabric, it stretches and moves with my postpartum body, which obviously is a must. I nurse in mine, nap in mine, and still feel super confident leaving the house in them too. I feel like I can really take on the world in these jogger sets, and the spit up stains just serve as a little extra go-go juice. Plus, they wash like a dream. There's no fading, there's no pilling, there's no shrinking, thank goodness. Just the same soft, cozy magic again and again and again. I've literally worn them on Zoom meetings, and no one even knew it was loungewear. And honestly, that is the kind of energy I need in my life right now when I am in this newborn bubble. Now, pair these joggers with their amazing bamboo sets. Voila, pure perfection. The gift that makes your sleep even better. These sheets are crafted from viscose, from bamboo, so they are super soft, just like the jogger sets. I'm telling you, when I am talking about like soft luxury, getting cozy and postpartum, this is exactly what I mean. Not only are these the softest sheets I've literally ever felt in my life, but they help you from overheating. They help you sleep several degrees cooler. They're perfect for snuggling on winter nights and waking refreshed for the holiday mornings ahead. So, if you are like me, living in that weird space between comfort and chaos, you deserve a wardrobe that does both. And trust me, this is the set that you'll be reaching for daily. Not only the joggers, but also the sheets. You can visit cozyearth.com and use code HeHe, that's HEHE, for 20% off to grab your new favorite postpartum uniform at cozyearth.com. And don't forget the softest sheets ever, because becoming a mom doesn't mean giving up style. It literally just means upgrading intentionally to be cozy, comfy, but stylish. One more time, that is cozyearth.com using the code HeHe, HEHE, to save 20% off. Okay, I want to dive into the allergies. So, obviously, if you have allergies in your family, that's something to be aware of. We've got the top 9 allergens to also
Mhm.
be aware of. I think the scariest part for a lot of parents is the reaction, right? We get hives sometimes. We can see rashes. Babies can have swelling, excessive droolingness. Obviously, in the rare, more extreme cases, anaphylaxis can be involved. So, talk us through what we need to know about introducing allergens when it comes to introducing solids in baby led weaning.
Yes, you got a lot of that right. Very on. It is usually the number one fear right after choking is allergens. What about that? And yes, I strongly recommend if there is a history or like older siblings who have had allergens to kind of do some more prep. You can often get a referral to a pediatric allergist to kind of make a plan. But if there's no sort of pre-existing reason, it is safe to introduce those big 9 allergens. Those there's 9 foods. They make up 90% of food allergies. So the chances that your baby is going to be allergic to some random food like peas is very low. if it's not part of the allergens, which are wheat, milk, eggs, tree nuts, peanuts, sesame, fish, soy, or shellfish. So those foods make up 90% of food allergens. And so if it's one of those things, there are some precautions that you want to take. The biggest things that I see are you don't want to introduce more than one at a time. You want to introduce each of those foods by themselves so that if there is a reaction, you know what it came from. If you give your brand new baby French toast, for instance, so it's got wheat, milk, and eggs, that's a great food once they've had those. But if that's at the beginning, you introduce French toast, they have a reaction. Was it from the milk? Was it from the eggs? Was it from the wheat? You don't know. And so you can't kind of isolate what that reaction came from. And so the advice on allergens is early and often. We are not waiting to introduce allergens. Once they're ready for solid foods, they're ready to be exposed to those allergens. And it's not a one and done. We got to keep introducing those foods to make sure that they're keeping them in their system, usually about one to two times per week, especially if it's not something you normally eat. A lot of people are like, I don't eat fish, I don't eat shellfish. And it's just one of those things to keep in mind and be a little intentional about keeping it in your baby's diet regularly so that they are exposed to it. Does that answer your question?
Yeah, it totally does. So, do you think, and I'm just kind of thinking in terms of like early and often, do you think maybe the first nine foods you introduce should be the top nine allergens? Like, should we start with wheat and then should we move to eggs and then should we move to milk? And once we get through those top nine allergens, then we can take on other foods. Do you think that's a bad idea? Do you think that it doesn't really matter?
That's a really good question. And like a good kind of that makes sense from what I just said. But I'm going to say I wouldn't recommend that. Another one of those pediatrician lovely statements that will last forever, it seems, is wait 3 to 5 days in between introducing new foods.
Yes.
And we don't have to do that,
Okay.
especially for things that are not the allergens. That being said, I wouldn't recommend, 9 days in a row, the first 9 days of solids, we're going to introduce each of the allergens and go. I think giving a couple of days in between would be wise to just kind of repeat that. So it could look like day one, you start with avocado. Day two, we do banana. Day three, we introduce eggs. And then day four, we go sweet potato. Day five, we try eggs again. And then maybe on like day eight, you bring in another allergen and now you introduce dairy and we do some yogurt and kind of ease them into that. I would say I don't want to put a harsh timeline on it, but by like the first 2 months of solids, have introduced all nine.
Okay.
So that's like a couple, if that's 8 weeks, like one a week to kind of get it and then keep repeating introduction. So I think you can introduce a new food every day when your baby is starting solids. And a method that I teach, it's not the only way, but is to start with a new food at a meal. Give them a few minutes, like 5, 10 minutes to explore just that one new food for the day. And then you can bring back previous foods and do kind of more like an option, a plate that looks more balanced. And so that's a good way to bring allergens back in as older foods and just not combining them at first.
Now, this is obviously, more prominent when it comes to allergen foods, but we obviously know that humans have allergies to the foods that are not in necessarily in that top nine. One that really shocked me was strawberries. I know two people in my life that are allergic to strawberries, and I've never in my life before I met these two humans thought about someone being allergic to strawberries. And so when I offered my friend like strawberries, she was like, "Oh, I'm allergic to strawberries." And I was like, "You're allergic to strawberries? I didn't know someone could be allergic to strawberries. That's so crazy." So I'd love to run through kind of What are the signs and symptoms of an allergic reaction, regardless of whether it's a top non-allergy or it's just a quote unquote regular food that we should be on the lookout for? Anaphylaxis is on everyone's mind, and I feel like it's pretty easy to identify. But what are some other things that we may need to know about?
Yes, the strawberries is interesting. I had a similar reaction with a friend's husband was allergic to potato.
So weird. I mean, not those humans
I
are weird, but just like a weird allergy. What a random thing. What random, not necessarily weird.
Yeah, I was just like, I've never heard of someone being
So
allergic to
crazy.
potato. That's
Yeah.
so interesting. Yeah, so hives is going to be a really big, like, most reactions are going to show up as an all over rash,
Like all over
which is,
their body.
yes,
Okay.
which is important to note because a lot of babies suffer from contact rash and like eczema with if they get food on their face or their hands or wherever else they mush food around, they might get some like redness and things like that, but that's not always an allergen showing up. It's just it can be a contact rash from especially from high acidic foods can do that. But an all over rash, upset stomach, irritability in babies, a 6 month old isn't going to tell you in their words that they're not feeling good, but mamas know.
Hmm.
And so watching out for just an unusual reaction. It usually will happen within 15 minutes to 2 hours if there is going to be an allergic reaction to a food. So even with the big allergens and the regular foods, you don't need to be, glued to your baby, watching them like a hawk, feeding them peanut butter in the hospital parking lot. It's a little much for me on the anxiety level. If it makes you feel good, I think it's probably more dangerous to be feeding in not a high chair and in a car seat, but I am not about telling mamas what to do, just about giving evidence-based information. And so that's kind of the thing. The irritability, also sometimes it can kind of go the other way and be like lethargic if, it's just not reacting well.
Okay, and when you say upset stomach, are we looking for mainly just like that irritable, hard to soothe baby, or are we talking about maybe mucousy poop, diarrhea, changes in their actual poop that are different than the expected of what we talked about previously?
Yeah, I would say if they do get consistent diarrhea from one specific food or like mucusy, then it's something worth checking out and following up with a doctor. Also, like vomiting later. It can be as part of the gag reflex. If a baby vomits eating solids, I'm not concerned about that in general, but if an hour later it just like all comes back up, especially if it's the one we're worried about, then that's something more to check in on.
Got it. Okay. All right. You mentioned feeding your baby in the hospital parking lot. And I think that these videos go super viral online,
Mm-hmm.
introducing peanut butter, sitting outside the hospital. Is there a case where you think that maybe doing it close to the hospital or under medical supervision is warranted? Or even if you have a history of, let's say, let's use peanut butter as the example, that, as long as you live 10 to 30 minutes from the hospital, you should be able to get there in time. And that gives your baby's body enough time to start showing warning signs and you to get to the hospital. Or are there certain factors, like individual familial factors, that we need to consider when introducing, let's say, known allergies? Because I think if you don't have any history of allergies, you have nothing in your family, then you can just confidently introduce them at home. But are there individual factors of anybody listening that you're like, okay, but if you have this, maybe you do want to consider something different?
Yeah, definitely a lovely TikTok trend to go viral to feed your
Always,
baby peanut butter
always.
in the hospital parking lot. But I think if you are in a situation like you're discussing, which is I have recommended a family seek out a pediatric allergist beforehand, and it was in their case because their older daughter had known food allergies to multiple nuts and eggs. And so they had twins and they were, obviously worried about that and the reaction. And so they saw a pediatric allergist beforehand and they can do a skin test that is safe and regulated. And then also I have heard of them introducing of like medically supervised introducing those solids like in the office
Okay.
with the allergist or the doctor. So if you're concerned enough that you need to go do that, go the full way. Get the help, get the thing. And if it's not medically indicated, you're fine to do it at home.
Yeah. Okay, cool. I think that's a really good distinction for people because, you know, TikTok can be so scary sometimes, especially when you see parents doing things that you've never considered. And then you're like second guessing yourself. You're like, should I be introducing solids in the parking lot? Like, am I doing it wrong? Am I putting my baby in danger? And, most of the time, no, you guys. But also, Alex and I both are really big on follow your instincts. So if your instincts are like, I'm doing the right thing, then go with it. But if your instincts do send up alarm bells and you're like, I think I would like some additional help with this, then yeah, seek that out. Okay, on the train of trends, how do you feel about the butter before bed trend where people will give their child either a spoonful of butter or let them gnaw on butter for bed for supposedly extra calories?
Yeah, I was like, she's either about to ask me about butter or bone marrow.
Oh,
Those are
okay. I
the
wasn't going to ask about bone marrow, but I want to talk about that too.
Those are the two things right now that are like all over the internet. I mean, it's fine. Babies need fat. It's not, I don't think there's anything wrong with it. I think it is very much just like a trend and gets a lot of views and a lot of likes because people are shocked by it. But honestly, people are shocked by a lot of baby led weaning if it's not something they're used to. So I'm not like anti butter before bed, but also I think it's a little bit kind of silly, if that's the right word.
Very Paula Deen of you to give your child a
I
literal
know.
stick of butter before bed. Okay, now what's your opinion on the bone marrow trend?
The bone marrow trend. So people are like roasting bone marrow and then I guess you whip it.
Hmm.
So that's like the crunchy mama best first food right now is whipped bone marrow. And I think it's like a good first food. It's high in iron and it's a safe texture and all the things, but also if you've never made bone marrow in your life and that's not a part of your normal diet, it's definitely okay to skip.
And it's
You
also
don't have to
very
do it because Instagram told you.
Yeah. Okay, the other trend I keep seeing is mixing cooked egg yolks. So like you boil eggs, take out the egg yolk and mix that in for choline, and I guess there's a lot of vitamins and minerals in that as well. What are your thoughts on that?
Good, as long as they have had egg exposure and you're not mixing it with the other allergens to kind of, because that is one of the big nine
Mm,
to kind of mix in. And so if there is a reaction that you know that it came from the egg or that it most likely came from the egg.
yeah. Okay, I want to talk about the baby led part of baby led weaning. You have mentioned several times, like, let your baby feed themselves. And I think a lot of people think that you're going to just give your baby food and they're just going to bring it to their mouth and they're going to swallow it up. And that's just what it's going to be. And so many people get into this journey and they find that their baby actually just smears things around the table and they bring a lot of it to their mouth and they may put it in their mouth even successfully, but then they spit it back out or they don't actually swallow and consume a lot of it. So, talk to us about that exploration process that's going to happen before they actually get in a good habit of truly consuming a lot of the food that we present them.
Absolutely. There's a lot of good stuff there. So, a very common phrase is food before one is just for fun.
Oh,
And It's, we say that to kind of take off the pressure that, it's not about the nutrition. They're getting that from milk. And so it's accurate in that way, but it's not just for fun. They're learning a lot and getting a lot out of, even if they're not getting the calories and the vitamins and nutritions from all the swallowing. The playing and the texture and the flavor exposure, that's all part of it. That's the point of what we're doing when we're introducing solids. And it can get messy. It's gonna get messy. It's just a fact of it. Motherhood is messy in all the things. This is just a new version of the mess. And it's okay if they're not eating a lot. One of my most popular podcast episodes is about trusting the process, even if they're not eating yet, because there's so much going on with their little brains and experimenting and learning and figuring it out that's not about food going from the plate into their mouth, into their stomach. That's like the least important part of the process.
So if they're not getting a lot of the food actually consumed, then we can't assume that the caloric intake is being replaced, right? So then are we not adjusting their liquid intake from their breast milk or their formula, or are we following that up with the purees? Are we then kind of hand feeding them the things that are on their tray? How do we ensure that they are still meeting their caloric intake, but we're also introducing these solids in a way that allows them this kind of like freedom of exploration?
So the answer to that is the milk. And that is, as far as the nutrition and the caloric intake, that's the powerhouse. That's what we're doing. There's a I know you have a worldwide audience, so some people will be like, oh, duh, of course. But in America, a common thing that has sort of happened is that the term baby led weaning came from the UK, and there, weaning, the word weaning simply means adding solids. There's not really connotation of stopping milk. But in America, when we hear the term weaning, you generally think of stopping breastfeeding. That's like what the term weaning means. So when you put baby led weaning, people think, oh, lessening milk, but we don't want to be especially for the first like at least 3 months. So kind of half of that from 6 to 9 months, their milk intake should not change at all. And then around then, like when you start adding more solid meals per day, I recommend mamas start with just once a day on solids at 6 months. And so the few bites that they're going to get from solids, finger foods, or purees is not making a dent really in their needs. So milk is still should be exactly where it was the week before. And then around 12 months is where food takes over the milk on the nutritional needs. Not that they don't need any milk anymore, that you can't keep nursing, but that's so there is a general, like a gradual transition, but we should never be purposefully lessening the milk before that year mark.
Okay, and are the rules kind of the same for our babies who, let's say, they were either premature, so we're working with an adjusted age, or a baby that had, let's call it a significant NICU stay. We're not talking about a baby that had like a 24-hour, 48-hour NICU stay, but some babies have significantly longer NICU stays. Babies that have, reflux or oral motor delays, are there accommodations that those families should be thinking about in terms of timing, readiness, the process of introducing solids?
Yeah, the biggest thing in there that's going to make a difference is if it was an early enough delivery that you're using adjusted age, you'll want to use that 6 month adjusted on starting solids and still looking for those readiness signs that we talked about, that they can sit up and hold their head up straight and do a safe swallow. If you have a baby that is an adjusted age lower than 6 months, but they're showing all the readiness signs and they are actually over 6 months, I think it's okay to kind of start and see how they do with that, especially with pediatrician approval. Pediatricians are not always super up to date on infant feeding, but they are generally good at keeping them safe on like when not to do it. I think if a doctor is telling you that it's not safe yet, I trust that a lot more than go for it.
Yeah.
Have the, go too early.
And if you are having this conversation with your pediatrician, can you give us some examples of questions that we might be able to ask to get evidence-based information, especially if our pediatrician kind of presents it as this really casual, with wrapped into a quick 10-minute visit. They kind of just throw it in there and hope that it lands with you and there's no more discussion. What sort of questions should we be asking our pediatricians to make sure that A, we're getting evidence-based information, but B, it's being individualized to our baby's development and where they actually are developmentally?
I think this is one of those situations where you have to do your research and know what you that you have to know what the research is. And because feeding is going to be, it's like a check mark on the 4 month checkup and it's a check mark at the 6 month checkup. And most doctors are not going to have a lot of information for you. And I think that it's really unfortunate to have to fact check your pediatrician, but that's where we're at,
Yeah.
unfortunately.
That's the American healthcare system right now, right? It doesn't mean that you're with a bad pediatrician. It just means that the same thing that it means with your OBGYN, you guys, they don't have a lot of time. There's not a lot of training on this. It is on that checklist. They're working with, low staffing and high caseloads, and it's just unfortunate. So, a couple things that come to my mind is if your pediatrician just nonchalantly says, like, you should introduce solids. Maybe you want to bring up my baby hasn't lost the thrust reflex, that tongue thrust. They're still very much doing it. My baby can't sit unassisted even for 90 seconds. You can bring up the things that you're noticing with your baby to help facilitate that conversation about maybe we're not actually there. And that way your pediatrician has some idea of like why you're not introducing solids. That way when you see them next time and they say how solids going and you say we haven't done it, they don't think that you are, quote unquote a non-compliant patient. They have realized like, wow, this mom actually knows her baby, and I spent 7.5 minutes in their room and didn't even think to ask about their development before I suggested introducing solids. Okay, my next question is about long-term data. So, what do we know about the benefits of baby-led weaning when it comes to oral development and eating habits compared to purees and traditional weaning?
So, the answer I'm going to give you is probably not what you expect, is that it's probably not going to make a huge difference
Okay.
in the long term. They're all going to get there. And how you start isn't going to, I'm not going to be able to look at a kindergartner and tell you, like, oh, that was a baby led weaning baby, or that baby was spoon fed purees. It's not going to happen. I think there is some benefit. This is more kind of anecdotal evidence of reduced pickiness because with baby led weaning, you introduce a lot of more foods and flavors and textures. Your toddler's still going to be eating beige food and buttered noodles when they're 3.5. No matter if their favorite food was avocado and salmon when they were 8 months old, it's a normal developmental track for pickiness to increase. That's what we expect, and it's not really a problem, but I think it can decrease pickiness. One of my foster daughters was with me as a baby, and so she was fully baby led weaning. Her favorite foods at 8 months were salmon, avocado, and watermelon. And that was like her typical diet. And then she had a little sister who was not in my home. And they're just about a year apart. It's like 5 days less than a year. And I have some contact still with their caregiver. And my daughter is a much more adventurous eater now at their 5 and 6. And so that's just one case. It's not that's going to fix everything. But I do think that had a big part of it is she was exposed to a lot more foods and a lot more things. And so her pickiness happened, but it was not so dramatic.
And would you say that maybe it's shorter lived, even that it's a shorter phase of pickiness?
I think it can be for sure. I think it might take longer to kick in because they've been used to these things. That's another like food before one just for fun. Yeah, except they're in this period where they'll accept new things. They'll try, they don't, they're not picky. When I have a mama who tells me, "Oh, my baby didn't like that." I'm always, what do you mean by that? Because it's very unusual for a 7 month old to not like a food. Usually it means like, oh, they were making a bad face or they just played with it, they didn't eat it. And I'm like, oh, that's just normal. That doesn't mean they didn't like it. That's just what babies do. Or they were having an off day. You know, babies aren't robots and sometimes they're just not going to be into it and that's okay. But you get all this opportunity to expose them to things and then they're more likely to continue to accept them than to accept them as introducing new foods down the road. 2 year olds don't like new foods.
I mean, yeah, do you even have a toddler if they don't live off of chicken nuggets, mac and cheese, and only the blue plate? I mean, that's not even a real toddler.
Exactly. And that will happen no matter which way you start. You know.
I love it so much. Okay, I think my last question is about introducing, for lack of a better term, tools, spoons, cups, things like that. Other feeding tools that obviously, as an older child and teenagers and adults, we all have the skill to use. When are we introducing spoons? And I'm talking about open top cups, so not necessarily sippy cups, but when are we introducing these tools and are we simply literally giving it to them kind of like we're doing the finger foods and we're letting them explore it and they will eventually pick up the skill of bringing the spoon to their mouth with food on it and maybe we put just a little bit of water in the bottom of the cup and they will eventually after a lot of spill, so be okay with the mess, they'll eventually learn to bring it to their mouth and drink. Is that kind of the right path?
Absolutely. So let's talk first about spoons. You, there's a very big difference between a traditional weaning spoon that's like for purees for mom or dad to hold. It's going to be long, have a long handle and a deep bowl on the end. And those are not the kind of spoons that we want to use. Spoons that are designed for babies to hold are going to be really like short and fat to fit in their hands and have a very shallow. I'll show you because we're on video.
Oh, yeah.
It has a very shallow. And the reason that those like shallow spoons like that is we can preload them. That's what we call it, where mom or dad scoops some food onto the spoon and then baby can pick it up and put that into their mouth because they're not coordinated. They're not going to be scooping up on the spoon and putting it straight to their mouth. That skill is going to take a good while, but you can introduce spoons like that even from 4 months as soon as you're starting. That's the way that I encourage puree, the baby led weaning way, is to let them explore purees with their hands and with preloaded spoons and just kind of be in it and explore and be messy and take a bath. And then open cups and straw cups are, we want to really actually avoid sippy cups. Pediatric dentists and all those things, they're not really good for oral development with the spout, but open cups are good and straw cups. So for an open cup, it can be introduced from 6 months. Again, it's not about getting in the liquid, but they can use those. My favorites are from Easy Peasy. I have a code, a discount code for y'all for that. And just put a tiny bit in. If they don't like water, you can also try breast milk or formula. It's often a little bit easier because it's thicker and it's a liquid that they're used to. And then straw cups are also really good. There's sort of three methods that are used to teach straw drinking. One is called the pipette method, where if you put your finger on the top of the straw and get some liquid in it so it's held there, and then you can put the liquid end in their mouth and let go a little bit so they get used to liquid coming out of the straw. There are honey bear straws or the easy peasy straw cups, where if you squeeze the cup, a little bit of liquid will go up the straw to kind of get them used to that. And then you can also put like a little bit of yogurt or even like fruit puree on the top of a straw to kind of entice them to put their mouth on it and to suck on it and get that association of, oh, when I suck on this straw, something happens. I get milk or water in my mouth.
Cool. That is awesome. I think that's also a common fear of parents of like, how am I supposed to get them to do this? And like, how much teaching does it actually require? And I think a lot of people are super surprised that a lot of this comes intuitive to babies. If you just give them the space to explore, give them the time, be okay with the mess, and just let them have at it, eventually they will pick up that skill. And you don't necessarily need to do too much. And I think a lot of people also get deterred by the mental energy and they're like, oh, but it's going to just, I just have to teach them all these things. And it's like, you kind of don't. You could literally just let them explore. And these skills are pretty intuitive to humans.
Yes, that just reminded me of one of the biggest benefits, I think, and the reasons baby led weaning is easier is the best way for them to learn is modeling. To watch you eat, watch you use spoons, watch you chew, watch you drink from a cup, and all those things. And you get to enjoy meals and eat with your baby because you're not sitting there trying to spoon feed them. And so you can't eat at the same time, but Baby led weaning lets you bring baby to the table with the family and eat a modified version of what everybody is eating and be a part of that experience from the get-go.
I love that so much. Oh my gosh. Alex, you are such a deep wealth of knowledge when it comes to baby led weaning and helping us introduce solids to our babies. And I love the way that you present it in a really neutral way. You just give us the facts, you give us the evidence, and then you really empower parents to do what is best for them, which obviously is the way to float my boat too. I love it so much. Okay, so if people wanted to connect with you, learn from you, you have some courses, some freebies, you have your own podcast. Tell us about all of that.
Yes, there's a lot of ways to connect with me. So I'm over on Instagram at Baby Led Weaning Academy. My website is babyledweaningacademy.com. I have a podcast, the Baby Led Weaning Academy podcast. I'm very on brand. That's on Apple or Spotify podcasts, also at babyledweaningacademy.com/podcast. I have a free class that covers baby led weaning basics called Orientation Day. It's at babyledweaningacademy.com/OD. I have a free guide that we talked about, Puree the Baby Led Weaning Way, babyledweaning.com/puree. I made a registry guide for all my pregnant mamas to, think past those first few months of postpartum, and 6 months will literally be here before you know it. So you can check out my registry guide. It's at babyledweaning.com/registry. I have discount codes for some of my favorite products from Easy Peasy. The code is BLW Academy. And for bibs and splash mats, kind of containing the mess, I love Bapron Baby. We didn't talk about it, but check them out. They're awesome, and you can get a discount. Baby, it's BLW Academy 10 is the code for them. And then I have a membership called the Baby Led Weaning Academy Club. And you can find that at it's babyledweaning.com/club. And I'm also offering a super fun discount code for any of HeHe's listeners. So it's month HeHe free, and you'll get one free month in the community if you come and want to hang out and learn from me for a month.
I love it. And you guys, I'll be in there in a few months. This baby and I are not quite there yet in our journey, but we will be in just a few months. And I honestly could not imagine introducing solids without Alex by my side. You guys, I hope that you enjoyed today's episode. And I hope that it empowered you to understand your options around introducing solids. I hope that we busted some of those myths. I hope that we also busted some of those crazy things you see on TikTok and the internet and all those viral videos. Not everything on the internet is as it seems. And introducing solids absolutely does not have to be frightening and scary, you guys. Alex makes it easy. She makes it consumable, meaning like you get small incremental education that you can then implement right there in your home that day or the next day to make it not scary. And she's right there to answer all of your questions. All right, Alex, thank you so much. You are such a joy. I loved having you on the show. Thanks for sharing all of your wisdom with our community. And listeners, I will see you in the next episode. Be sure to follow Alex on social media. You can find me at Tranquility by HeHe and at the.birth.lounge. Until next time, head to your app store and download the Birth Lounge app for evidence-based childbirth education and data-driven postpartum support delivered straight to your phone. Bye. Thank you so much for tuning in today. I love hanging out with you, and it is an honor to be your go-to gal when it comes to preparing for your baby. If you've enjoyed today's episode, please leave a 5-star review and tell others why they should be listening to the Birth Lounge podcast too. You deserve to have a birth that you love with a provider that values your autonomy and respects informed consent without all the trauma that you so commonly hear about on social media. New episodes air every Wednesday and Friday. Hit that follow button so you never miss an episode. I'm HeHe, and this is the Birth Lounge Podcast.